completed autopsy report done for Alexavier Pedrin?
Yes, it was.
And was that done by you?
Yes.
Would you recognize that document if you were to see it in court today?
Yes.
Hey, before we can begin, can you just come on up for a second?
Sure.
Go ahead.
Permission to approach?
Yeah, go right ahead.
I'm handing you a spin marked as State's Exhibit number 27. Can you review that and let me know when you're done?
Okay.
Is State's Exhibit 27 a copy of your autopsy protocol report for Alexavier Pedrin?
Yes, it is.
Okay, I'd move 27 in evidence.
No objection. Okay, received.
Before we start diving into the specifics of the autopsy for Alexavier Pedrin, I want to talk about the classifications that you can make for the manner of death. There are, as I understand it, 5 different classifications. Is that correct?
That's correct.
What are those 5 different classifications? Can you explain those to the jury, please?
Sure. So when we look at a death certificate, medical examiners have to look at filling out cause of death and manner of death. And the manner of death is a medical opinion that's composed of 5 options. So those are basically natural, so natural disease, accident, homicide, suicide, or in some cases undetermined.
And those are the 5 options that you have when you reach manner of death. Is that fair?
Correct.
Okay. Cause of death can be many things. Is that also fair?
Yes.
One of the options that you mentioned was homicide as a manner of death, correct?
Yes.
And I just want to give an example. A manner of death can be ruled homicide. Homicide in your world means death at the hands of another person, correct?
It's either due to the actions or inactions of another person, yes.
Actions or inactions of another person. So for example, if someone were frustrated with me and I tried attacking them and they shot me in self-defense, them shooting me in self-defense could be ruled a homicide, but it may be legally justified if it was actually self-defense, correct?
That's correct.
Okay. So you can have different outcomes from your determination from a medical perspective and a legal perspective.
Absolutely, and we have the opposite occur quite frequently in motor vehicle accidents. So by definition, most of those, unless there's intent that we have, those are called accidents. So if someone strikes another vehicle, but those can be prosecuted as vehicular homicide or whatever. So there's a distinction between the medical terminology and the legal terminology.
For example, if I were driving drunk and I caused an accident by my drunk driving and the passenger of my car died, I could be legally responsible, but it would be declared by a medical examiner an accident.
That's correct.
Okay. I want to talk now about the specifics of performing the autopsy for Alexavier Pedrin. What was the date that this autopsy was performed on?
The autopsy date was February 13th.
February 13th?
Of 2023.
This is 2 days after the death of Alexavier Pedrin.
Correct.
Okay. When you are conducting the autopsy, do you get background information about the circumstances of the death?
Yes, I do.
Did you have that in this case?
Yes.
What was the background information that you had prior to performing the autopsy?
So prior to performing the autopsy, we usually get sort of a compiled narrative that is from one of our local death investigators who speaks to the family, speaks to law enforcement, kind of gets the information they need to give us an idea of what the case is about. It's certainly not all-encompassing or all-inclusive, and other information may show up as we go. But in general, we knew at the very beginning of the case that the child was found unresponsive at home, and that there were some pill containers near the body, and That was the main thing, and that basically he was dead on scene and not transported to the hospital.
Okay, so he was found unresponsive at home. There was a pill container or more found on scene, and he was declared deceased on scene.
Correct.
Okay. That was the basic information that you had.
Yes.
I want to talk now about the examination of Alexavier's body from the outside perspective. What is the first thing that you took note of when you were examining Alexavier Pedrin's body as a whole from the outside?
I think some of the things that stand out at the very beginning, just doing the cursory beginning of the external examination, is number one, that he had a cast on his right leg. And we didn't have at that time too much information about that, but there was a hard cast. And then also, as we removed the clothing, just in general, he had sort of a look of, I won't say malnourishment, but just dehydration. So you could see the ribs pretty prominently. The eyes were kind of sunken. And then there were a lot of bruises and other injuries that we'll describe later. But overall, that was what we saw.
With regards to the dehydration, the sunken eyes, and the pronouncement of the rib cage, what, if anything, did that tell you from a medical perspective?
That he didn't seem to have enough fluids at the time. Now, that could be that he wasn't receiving them or that he was sick. You know, it's hard to say in a vacuum without knowing anything else. But he certainly didn't seem well hydrated.
If this was a child that was reported to have COVID relatively recently, that could be one potential cause for that presentation or a contributing factor.
Could, if the COVID was causing him to have vomiting spells or something like that, then maybe. But if they're still eating and drinking properly, then probably not. So.
Then you wouldn't expect to see that type of pronouncement with the ribs or the sunken eyes?
Not necessarily. You'd have to have some reason. Either they're not taking in enough fluids and food, or they're vomiting, having diarrhea, something like that. So it could be related to COVID, depending on how you react to COVID.
I want to talk now about your examination and documentation of the injuries on the outside of Alexavier's body. Did the number of bruises on Alexavier's body stand out to you?
Yes.
Did the location of those bruises stand out to you?
Yes.
Did the frequency of the bruises in different locations stand out to you?
Yes.
Okay. You would recognize photographs from the autopsy if you were to see them in open court today?
Yes, I would.
Okay, I'm going to show you what's been marked as States Exhibits 29 through 56. Your Honor, the record should reflect that States Exhibit 57 is also a PowerPoint that contains these very same photographs. Doctor, I'd ask you to review 29 through 56 and let me know.
Okay.
Do States Exhibits 29 through 56 fairly and accurately capture the outside physical condition of Alexavier Pedrin's body on February 13th of 2023 when you performed the autopsy?
Yes.
I'd move 29 through 56 into evidence.
No objection.
Received?
Permission to publish.
Objection.
I'd ask that I'll need control for the PowerPoint for 57, please. Oh, PowerPoint is 28. I'm sorry. That's my fault. Dr. Quinton, can you see the screen?
Yes, I can.
Okay. You see the first photograph that's being displayed for the jury?
Yes.
Okay, is that the first photograph that you have in your stack?
Yes, it is.
Okay. Can you describe to the jury what we see in this particular photograph? You have the number, so if you could help me give me what number this is.
Sure. This is exhibit number 29. This represents what we would consider our identification photo at the time of autopsy. So on every case, we always do an identifying shot that just shows the features of the face from directly on.
In this photograph, explain to the jury the injuries that we can observe on Alexavier's face.
So there are a number of bruises and a healing, excuse me, a healing laceration on the right eyebrow. So kind of going from top down, I don't have a pointer, but still, Right in the middle of the forehead near the hairline is one bruise. You see a cluster of bruises around the right eye, so basically very lateral on the eyebrow is a healing laceration or basically tear of the skin with a contusion around that. Contusions are just bruises. And then the upper and lower eyelids, basically you see those area on the right eyelids, those areas of red, those are both bruises on the upper and lower eyelid. There's two bruises on the right side of the chin as well, one a little bit more linear down at the bottom and one that's a little more circular, a little higher than that. Just in general, too, you can also make out that those eyes, the orbits seem to be kind of sunken as well, which we talked about earlier.
Can you make out in this photograph any injuries to Alexavier's neck?
There's two on the left side of the neck right along the edge of the mandible. You can barely see them in this photo. There's also a little tiny abrasion, little line on the right side of the neck. But really, the ones that I documented were on the left side of the neck, right under the mandible.
And you talked to us about a case number when the body is received. Is that what we see on the ruler in the bottom of this photograph?
Yes, it is. So we will try to make sure that that number, that case number, is on every photo that we take.
All right. If we can move on to the next photograph. Doctor, again, I'm going to ask your indulgence in helping me with what number this is in the photographs in front of you.
Sure. So this is exhibit number 30, showing some of the same injuries that we saw in the last image, but this is on the right side of the face, so a lateral shot. You see the two bruises of the chin that I described earlier. Similarly, that mark on the lateral, so outside portion of the right eyebrow, which was that healing laceration we talked about earlier. A little bit of the bruising of the upper and lower eyelids, but also there's a sort of a little vertical linear abrasion on the side of the face here, which in the report would be described as sort of the zygomatic region of the face. And I think that's most of what is shown in this image.
When we're talking about bruising, doctor, it's fair to say that bruises cannot be dated with any medical precision. Is that correct?
That's correct. There used to be old textbooks and things like that that would make an attempt to do it, but honestly, we're very, very cautious. The only things we'll ever say, we'll describe them, so we'll say if they're red or purple, those tend to be kind of quote-unquote fresh, but we don't say, we're never going to say it's an hour, 2 hours, things like that.
Okay. Fair to say that we expect bruising to show up within hours of an assault, though. Would that be fair?
That is fair, in most cases, yes.
Okay. In this photograph of the right side of Alexavier's face, can we also start to see bruising in his hairline?
Yes, you can. So I mentioned earlier that there's one in the middle of the forehead. We're now looking a little bit on the right side of the forehead, and you can make out the beginnings of one bruise there.
When we're examining bruises on someone's body and we're examining whether they could be from accidental means or inflicted means, is it important to look at the number of the bruises?
Absolutely.
Why is that?
Well, so any one circumstance of blunt force trauma, so just a bruise or a scrape or something like that, could be from any number of things, and you could come up with many explanations. So if you're looking at each one individually, unless they are distinctly patterned, you can't really say what they're from necessarily. So then we also rely on the sort of distribution, where they're located, and then also the number. So in kids or adults, for that matter, when people fall, hit their head, they tend to hit areas that are sort of bony prominences and things that stick out. So especially in kids, you're going to typically see things, they're going to have bruises on their elbows, bruise on their knees, things like that are kind of accepted to be sort of classically accidental, although, again, they could be inflicted. But when we look at the totality of the number of injuries, that's where we start to sort of accumulate data to decide at what point is this too much to be what we would accept as just accidental.
When we talk about children and bruising on children, are you familiar with the term of protected areas and not protected areas?
Yes.
What does that refer to?
So basically, it kind of goes back to what I was talking about earlier with bony prominences. So there are some things that just stick out that are naturally the places that people will hit, and then there's other areas that are much more protected. So for instance, inner thighs, gluteal folds, folds that normally you would have to have some access to get to damage.
And we talked about it a little bit earlier, but looking at this photograph, can you help us understand when you have bruising on different planes, what does that mean? Different planes of the body, different planes of the face?
Right, so the locations here are sort of multiple. You know, we've got forehead, eyebrow, eyelids, which is unusual. That would be more of a protected space. Chin, again, each and every one of these, except for maybe the eyelids, would be something that you might typically see in another scenario, like somebody fell and hit their head. But all of these in constellation are a lot of different injuries. So you would have to have a reason to have that many different injuries.
When we look at this photo of Alexavier, we can say that there's been multiple blows. Is that fair?
That's fair. There's at least 5 or 6 points of impact just in this one image.
Okay. If we can move to the next photograph, which is the left side of the face. Nope, I apologize. It's a close-up of the right eye.
Correct. And this close-up, which is Exhibit 31, shows the upper and lower eyelid. Again, that red discoloration is bruising. That edge of the eyebrow where we've got the healing laceration, and a little bit of the bruising in the hairline as well, plus that small abrasion on the outside of the face.
Dr. Quinton, I place in front of you a laser pointer, if that is helpful to you at any point. I believe it's the circle button in the middle.
Got it.
All right, if we can move on to the next photograph, please. What do we see? This is 32?
This is Exhibit 32. Not nearly as many injuries on this side of the face, although we do see the 2 little linear abrasions that were underneath the mandible, so the angle of the chin there, or not chin, but jaw, that are extending onto the neck.
And again, this would be a completely opposite side of the head, a different plane altogether than what we looked at in 30 and 31.
Correct.
Okay. Say Exhibit 33.
So Exhibit 33, unfortunately on cases like this, we oftentimes have to shave the scalp so that we can actually see beyond the hair to assess the injuries. So in this case, we're actually looking at the top of the head straight down. So the top where the case number is would actually be the forehead, and then the bottom of the screen where the hair still is intact would be the back of the head. And so we're looking at several more contusions on the top and the side of the scalp, basically a large kind of 6 centimeter red contusion or bruise that's on the right frontal scalp, just slightly to the right of midline, and then also a separate bruise on the what we would call the right parietal scalp with a little abrasion over it.
Again, different planes than the other photographs that we looked at previously.
Correct.
Takes Exhibit 34. What do we see in this photograph?
Okay, so 34 is the scalp a little bit more shaved and on the side. So we're again looking at the right side of the scalp and face again. You can still make out that healing laceration that's over the eyebrow, but now you can see a little bit better the different areas of bruising. There are a few of these darker dots or little abrasions or scrapes, but then the red areas are all what we would call, again, contusions.
One of the dark spots that you pointed to, I took to be a mole or a birthmark. That's not a mole or a birthmark?
If you're talking about this one right above the ear, that's another abrasion.
That's an abrasion?
Yes.
Okay, and it's in a circular pattern?
Yes.
Okay. Is there any bruising also in the ear?
I don't recall there being any in the ear. There is a little bit of red discoloration, but I think that's mostly lividity.
Okay. What's the difference between lividity and a bruise? First, can you explain what lividity is to the jury?
Sure. So when someone dies, their circulation stops, so their heart stops beating. When that happens, all the blood in your body just pools towards gravity. So you will see a patchy red discoloration on the parts of the body that are dependent towards gravity. So in many cases, if the body is laying face up, then everything will pool towards the back. And so you'll see this kind of dark red or patchy red discoloration. So that's what we mean by lividity.
In a little bit, we're going to see pictures of Alexavier's back. You as a medical professional have training on how to differentiate bruising from lividity?
Yes, and sometimes it can be difficult, which is why we will look under the skin as well. And particularly in his case, in the back, there are some areas that look a little concerning for a bruise, but then underneath, it's really not. It's just that pooled blood.
Okay. We'll talk about that a little bit more when we get to those photographs. I think we were on 33?
So this one is 34.
34. So if we can move on to State's Exhibit 35. Now this is 35, 36, and 37 in
Correct.
sequential order. Is that correct?
That is correct. So yeah, these are basically kind of rotating around the back of the head, and again, having to shave hair. Most of these areas that you see that are the red discoloration are more areas of bruising. A lot of that is confirmed when we reflect the scalp, so when we actually make an incision in the scalp to get to the skull later, we will see bruising underneath the scalp to kind of confirm that these are bruises and not just lividity. But yeah, so you can see kind of the patchy red discoloration. And there's
Those
also,
would be additional planes, additional blows?
correct.
Okay. Can we move on to the next slide, please?
Okay.
38.
This is 38. So anterior neck image and under the chin. Basically, there was a linear bruise under the chin here. The two linear abrasions that we noted earlier along the jawline, and then it's not in the report, but that little tiny scrape there too.
Were there any injuries inside of Alexavier's mouth that you noted?
No, there were none in the mouth. So we do look at the gums, the inner mucosa of the mouth, because if someone is struck in the face, they might tear their inner lips up against their teeth. There's nothing like that. We also did what we call an anterior neck dissection, which is looking layer by layer by layer through each layer of the musculature of the neck, just to look for any additional bruising that might be related to something like strangulation, which there was none in this case.
You didn't find any of that bruising inside the layers of the neck?
No.
Okay. You can, to be fair, Dr. Quinton, you can strangle someone and not have those bruises appear. Is that true?
That is true, yes.
Okay. And you can cut off oxygen to a child by means other than choking them through the neck. Is that also true?
That is true.
Okay. We can move on to the next image. These are, can you help me orient with the numbers on these, please, Doctor?
Yes, so these would be exhibits 39, 40, and 41.
Okay, I'll start with 39. What do we see in States 39?
So all of these images are showing us the anterior chest and abdomen, but 39, the first one on the left-hand side of the screen, is just representing the right side of the chest. There were a cluster of bruises that we could see on the chest wall here. There were about 3 or 4 that you can make out in this image, maybe another one down there. You can also note in both of these just the prominence of the ribs as well.
And in the last photograph, can we notice the prominence of even the arms and the sunken eyes?
Yes. I will note, though, in your images here, this one's reversed. I'm not sure how that happened in PowerPoint, but this image is actually reversed. So if you notice, the number is backwards, and all of these bruises should be on the right side.
Oh, I do see that. Okay.
So the only other thing I was going to note is the mild green discoloration on the abdomen. That is not an injury. That is another postmortem artifact. So there was a little bit of a delay between the time that he died and the time that we did the autopsy, and in that time we are seeing some postmortem changes. So that faint green discoloration is just early decompositional change.
So that's a natural
That's a natural
process.
phenomenon, yes.
Okay. What can you tell us about the frequency of bruises that we see in these 3 images?
So again, they're kind of clustered. There's at least, like we said, up on the chest here, a cluster of about at least 4 of them here. There's one over what we call the xiphoid process in the middle of the chest. There's also one that I think we have another image of that's over the left shoulder as well. So multiple points of impact, different locations.
And the record should reflect, Your Honor, that the very last image, Doctor, what number is the very last image?
The last image is 41.
41 does have a black box over the genitalia of Alexavier. The images that are being admitted into evidence do not have that, but I was taking caution in using these in open court. All right, if we can move on to the next image.
Okay. The next images are all of the right upper extremity, so the right arm. These are 42, 43, and 44. We have in the image to the left of the screen, basically the arm is raised, and we're looking at 2 areas of bruising on the inner right arm and inner right forearm, basically 2 of them in parallel on the forearm, and then one larger one on the arm. The small round bruise, this is on the opposite side of the forearm, the right forearm, that's in the middle image. And then image number 44, which is on the right side of the screen, is basically just a close-up of the bruising that we see on this arm.
When we were talking about protected areas before, this is on the inside of Alexavier's arm, what we see in the first and third image on the PowerPoint on this slide. Is that correct?
So I think of extremities as sort of a mixed bag. Obviously, if you fall, you're going to land on the outer surfaces, but that doesn't mean that you can't do something accidental to injure the inner surfaces. So mechanistically, I'm not sure if I would include some of these as some of those protected areas, but certainly more protected than the outside, the outer surfaces.
And upper arm, even more so from a fall, depending?
It just depends.
It all depends. Okay. Next slide, please. Okay. What numbers are these, Doctor?
These are numbers 45, 46, and 47. The number 45 on the left-hand side of the screen is sort of a combined abrasion and contusion it's kind of on the upper left side of the back near the, or excuse me, right side of the back near the left arm, if I'm looking at that one correctly. This middle image is looking down at the left shoulder. So the body is going downward from here. The knee is down at the bottom of the screen. So that's just a bruise over the left shoulder. And then the image on the right-hand side of the screen, which would be Exhibit 47, is another bruise on the left forearm.
Again, multiple different areas of the arm, correct?
Correct.
Including the top of the shoulder?
Correct.
All right, if we can move on to the next slides, please. What do we see in these three images?
Okay, so these are all images of the back. This would be Exhibits 48, 49, and 50. Again, this one's a little bit more complex because there's multiple things we're looking at. Some of this is bruising, but a lot of this patchy red discoloration is that lividity I talked about earlier. So especially as we move up the back on the left-hand image, which is sort of the far away image, you can see there's an area of distinct bruising over the buttock region, right near the cleft in the middle. But then this area sort of just above that looked to be another bruise. It really turned out just to be more lividity. Some of this is patchy. This is all patchy lividity above the waistline as well. But then this other sort of circular or two circular lesions here on the right side of the back, which is close up in the middle image, that is a bruise, but it's more of a brownish bruise instead of red. So this would be maybe something a little bit in later stages of healing. We haven't really talked too much about the different colors of the injuries, but if they're brown, they tend to have been around a little bit longer. You also can make out in several of these images that there are some scars. So there's a scar of the lower right side of the back and a little linear scar right above the buttock. Can't make out what those are from. A little bit unusual location because, again, a little bit more protected than some other areas that you would expect to see scarring on.
All right, next image, please. What numbers are these three images, Doctor?
So these are all the left leg. We're looking at Exhibits 51, 52, and 53. So going from top down, if you look at the left-hand side of the screen, this is the left thigh and the left knee, and then these are just images that kind of focus in on the different areas. But the left thigh has a large cluster of bruises sort of on the anterior, so front of the left leg, but also, or left thigh, but also on the inner part of the left thigh, because this is rotated sort of to show the inner surface. We also see some scrapes on the left knee as well, some circular abrasions on the left knee, and then two linear abrasions on the medial aspect of the left knee, so the inside of the left knee as well. The other two images basically just highlight those injuries.
When you're examining the circular abrasions to the knee, does that give you any pause or concern for inflicted injury?
It's really hard to say. The ones on the knee itself could just be falling and scraping your knee. So it may be of all things, it doesn't look patterned. Of all things, that might be one of the few injuries that I'd expect to see on a kid who's 6 years old.
From a fall?
Yeah.
Okay. But the other bruising, that you described on the upper portion of the thigh, it's a little bit on the inside of the thigh. Is that correct?
Correct.
Okay, that's obviously more concerning.
That's much more concerning, yes.
Okay. Next image, please. What number is this, and what do we see here?
This is exhibit number 54. This was a bruise. So basically, we're looking at the left side of the body. The buttock is on the top of the screen. The left leg is right below that. So it's one prominent red bruise sort of on the lateral aspect of the left buttock.
Okay. Next
Or,
image,
excuse
please.
me, I'm sorry, I keep saying left. That's right.
That's right.
My apologies.
Next image, please. And this is a picture of the thorax from the right side?
This is a picture of the thorax from the right side, exhibit number 55. Again, the prominence of the ribs is noted here, but there's a cluster of 2 bruises on the lateral side of the body.
Some bruising might be expected when CPR is performed. Is that correct?
Yes, but this would be a very strange location for that.
Okay, that's what I was going to say. This is not where CPR would be expected to be performed, correct?
That's correct.
Okay. And they've already had the benefit of seeing the CPR in this case. We'll move on to the next image, please.
Okay, and this is image or exhibit number 56. This is of the left hand, and very specifically 2 areas of bruising. This area right at the base, sort of at the base between the left thumb and the left index finger. Part of this extends onto the what we call the thenar eminence of the left hand. And then another bruise that's sort of on the back of the left hand as well, what we would call the dorsum of the left hand.
Is that the last image?
That is the last image I have up here.
Okay. When you are looking at the number, nature, and frequency of the bruises on the outside of Alexavier Pedrin's body, tell us what your impression is of all those injuries before you even start the internal examination.
Well, the constellation of all the findings externally was too many injuries to account for just an accidental fall or something like that. So this looked as a constellation of finding like inflicted trauma.
When you're practicing medicine, is it important to look at the patient or the, in this case, the body that's in front of you and examine the totality of the circumstances?
Absolutely.
Okay, you would never look at and examine one finding in a vacuum, is that fair?
Correct.
That's not the practice of medicine.
No.
So the number, nature, and frequency of the bruises that you observe just on the outside of the body would be consistent with multiple blunt force injuries inflicted by another person?
Yes.
Okay. Let's talk about your internal examination of Alexavier Pedrin now. What did you find when you performed the internal autopsy?
Sure. So it depends on where you're looking, but the internal examination, if we just start from the head and work our way down, basically reflection of the scalp, as I said before, kind of confirmed the multiple bruises and impact sites that we saw externally. But then once we opened the skull, there was no evidence of a skull fracture or anything like that, but there was evidence of prominent swelling of the brain itself, but no bleeding internally or anything like that. Moving down the body into the trunk, or do you want me to?
Can I stop real
Please.
quick and talk about the swelling of
Yes.
So the swelling of the brain, what is the name for that?
So basically, cerebral edema is what that is. It's basically just fluid accumulation that expands the brain itself. The brain, when it swells, that is pretty much the only reaction that the brain has to anything. So any kind of insult to the brain potentially is going to make it swell, or there'll be cerebral edema.
Is that referred to as hypoxic ischemic injury?
So hypoxic ischemic injury is sort of the end description pathologically, but yeah, when we first start out, we just look at it and call it swelling. It's just cerebral edema. But then microscopically, we can confirm that there's hypoxic ischemic injury, looking at is there damage to the cells, things like that.
Okay. Many things can cause brain swelling. Is that fair?
Yes.
Trauma to the brain
Yes.
from a blow to the head?
Yes.
A lack of oxygen to the brain?
Yes.
A slowing down of our system that delivers oxygen to the brain?
Yes.
Okay, all of those things can result in that same brain swelling that we see.
Yes.
Is there any way for you to medically determine if one or multiple causes led to the swelling of Alexavier's brain?
In this particular case, no.
Okay, so it could be one of those things, it could be a combination of all of those things together.
Yes.
And in this case, we already know there's been multiple blows to the body, correct?
Correct.
Including to the head.
Yes.
Okay. When we experience a concussion, when we refer to a concussion, what is that's happened to our body?
So a concussion is very similar. So you have a blow or sharp movement of the head that kind of stretches, if you will, the neurofibers within the brain itself, but it doesn't break anything. So a concussion usually, given time, will resolve itself and the brain will go back and kind of go back to normal, quote unquote. That's very different from if we had blunt trauma that actually sheared some of those neurons, which would then not necessarily be able to heal because neurons don't heal like that. So it's a little bit of a difference. But concussion is sort of a transient injury.
When I think as a layman of concussions, it makes me think of the NFL and how the National Football League examines concussions. They look for symptoms by talking to a person and examining them from the outside. Is that fair? Is
That's fair.
that one of the first ways that one can look at or try and assess if someone has suffered blunt force trauma and maybe suffering a concussion?
Yes.
Okay. We were going to move down from the head downward in Alexavier's body. What's the next injury that you detected in Alexavier's body?
Sure. So doing the examination of the torso, basically chest and abdominal cavities, there weren't many injuries of the upper torso. So basically heart was fine, lungs were fine. Once we move beyond that, the next sort of layer is the diaphragm that actually separates both the upper and lower cavities. And there was some bruising on the right hemidiaphragm, so the right half of the diaphragm. Below that, within the abdomen, the first thing we noticed on opening the abdomen was that there was free blood in the abdominal cavity, so what we would call the peritoneal cavity. We collected it. We were able to collect about 100 milliliters of free blood in there. That's not a ton of blood, but I mean, it's a substantial amount. And then after we kind of got past that, there was both what we would call a subcapsular hemorrhage of the liver itself. So basically the liver has a capsule, and a subcapsular hemorrhage would be kind of like a bruise under the capsule, but it's sort of retained in that capsule so it doesn't go out into the abdomen. There was also a laceration or tear of the liver itself. There was also a lot of hemorrhage around the duodenum, which is the very first part of the small intestine, and the head of the pancreas. And all of these things, for the most part, sit sort of within the midline of the abdomen. Let's see. I've already described the liver laceration and the free blood. Oh, and then examination of the abdominal, or the chest wall, I should say. I said there were no injuries of the lungs or the heart, but once we were able to visualize the ribs, there was evidence of one recent fracture of the left 10th rib posteriorly, so basically along the back.
Posterior is the back, left side back, 10th rib.
Correct.
Okay. And you said that that's a recent fracture based on your examination. When I think of talking about rib fractures, I think of talking about them as acute and subacute in a live child. Do you use those same terminologies?
We'll use acute, subacute, organizing, or remote.
Okay. When we talk about an acute fracture in a child, whether alive or deceased, really all you can do is date it within a certain number of days, correct?
Correct.
Okay, so you can't date a rib fracture to hours.
No.
Okay. It could have happened anytime prior to that child being deceased.
Well, depending on what it looks like. So if it's a very acute fracture, which basically means there is a break in the rib with hemorrhage, but no evidence of healing whatsoever, that's a shorter time frame. So you can't look at that and say, oh, that happened 3 weeks ago, because it would have evidence of healing. But we can look at this and say it's fairly recent, meaning, probably within the last 24 to 48 hours, but that would, still, it's a very wide range.
Rib fractures are painful?
Yes.
They hurt when you breathe?
Yes.
In some cases of children and adult, you maybe see a rib fracture in the front of a child related to CPR. Is that correct?
Less commonly in children, only because their ribs are soft and pliable, so there's a lot more cartilage depending on how young they are. But sometimes you still can see rib fractures in CPR, even in children. But when you do see them in adults or children, related to CPR, they tend to be what we would say is sort of either anterior or anterolateral, so they kind of are right along these lines.
They're not posterior rib fractures.
Typically, no.
And this is it a higher up or lower fracture in the back, the 10th rib?
It's low in the thoracic cavity. It's kind of mid-back if you were looking at the back.
The liver laceration that Alexavier had, that was approximately 3 centimeters, is that correct?
Correct.
Is that a serious injury?
Yes.
Were the internal injuries to Alexavier's abdomen life-threatening injuries for him?
Not immediately, but they could have been. So, meaning if that liver laceration went unattended, it might heal on its own over time, or it might get progressively worse and continue to bleed. Similarly, injuries to the duodenum, so the small intestine, or the pancreas, both of those could become worse over time. So as they react, as they start to try to heal, they oftentimes are in a very vulnerable state and can potentially get worse before they get better.
In your experience, would these have been painful injuries?
Yes.
Would the pain have gotten worse over time?
Yes, most likely.
Would the individual who is suffering from these injuries not want to move as that pain progressed?
It's very difficult to say for any given individual, and when you say not want to move, that's a pretty broad stroke. So I would say they would be less active potentially than normal, but I wouldn't be able to say if they would just be laying in bed and not want to move versus maybe not as active as classic.
That pain would become more pronounced over time?
I would imagine so, yes.
Would you expect the symptoms to be obvious to a caretaker?
Yes.
What is the mechanism for the injuries to the internal organs? The duodenum, the lacerated liver, what type of force is necessary to cause those injuries?
So all of these are from, you've heard us use the term already, blunt force trauma. Blunt force is just basically an object striking an object. It's not a gunshot wound. It's not related to a blade. It's just a crushing blow or a scraping type blow. So that being said, the mechanism in this case is classically, basically, if you receive a blow to the abdomen or the upper abdomen, lower chest, whichever, anything in between the object, be it a hand, be it a foot, whatever, and the underlying spinal column, which is rigid, anything in between those two things could potentially get injured. So all of these things that we're seeing sit right in the midline. So the liver laceration, the injuries to the duodenum, the injuries to the pancreatic head, every one of these is in line in the center between the abdominal wall outside and the spine on the inside.
Can the injuries that we see in Alexavier's abdomen result from one penetrating blow to his abdomen, more penetrating blows, or can you not differentiate based on what you see medically?
So first, I just want to caution the use of the word penetration because that to us that means actually going through the skin.
Oh,
so
I'm using the word different. I mean it differently than you do. So thank you for clarifying.
Sure. It could be just from one blow. It could be from several blows. It's anything that would be striking the midline.
You mentioned that these were life-threatening injuries for Alexavier. Can you explain that process a little bit, how these would be life-threatening? So
there's several things that could cause this to become much worse. Number one, bleeding. The liver is very, very vascular. It likes to bleed. So again, unchecked, could this heal on its own? Maybe, but it could also bleed and get worse. In addition, the injuries to the small intestine and the pancreas, over time, particularly the pancreas, as the pancreas becomes inflamed, you can start to see a lot of very crucial problems with that. The patients oftentimes may go into shock or multi-organ failure depending on how badly that progresses. The duodenum, might heal on its own again, but also very potentially could perforate if the wall is weakened as it's trying to heal. And so then you run into a situation where maybe a couple of days after the event, now the person becomes acutely much more ill, and it's because the contents of whatever they're trying to eat are now spilling out into the abdomen because of the damage to the duodenum. So several different mechanisms for how those things could potentially be life-threatening.
Doctor, did we cover all the internal injuries that you documented in performing the internal autopsy for Alexavier Pedrin?
I believe we did, yes.
Okay. One of the other portions of the autopsy that you mentioned was toxicology and histology examination.
Correct.
Let's talk about toxicology examination. What were the results of toxicology for Alexavier?
So on his tox, I believe there were only two things that we detected. There was melatonin and alprazolam, which is commonly known as Xanax.
Was there caffeine detected or no?
I have to go back and look. I don't recall, but it could be. Give me one moment here.
Sure.
There was a presumptive positive on our screen for caffeine. I don't remember if that was verified or not. So I can't tell you for sure.
There was a presumptive positive, meaning that a screen test positive for that, but there was no confirmation.
There was no confirmation, correct.
Okay. And caffeine's not a lethal or dangerous substance?
In most instances, no.
Okay. I want to talk about the Xanax levels that were detected in Alexavier. What were those levels?
So the levels were 250 nanograms per milliliter, although I say that with caution for both of these drugs because we're testing basically the blood that we collected within the abdominal cavity, so that free blood we described earlier. It's very difficult to get good blood samples in children to begin with post-mortem, and so oftentimes our sample size is pretty small, and this was the best we could get. The reason I mention all this is because cavity blood is not the best sample to use to accurately assess the levels of a drug. It's much better just to assess plus or minus. So is it there or is it not there? That level of Xanax is high, in the high range, but again, I can't tell you with much certainty what that translates to in this case.
What type of drug is Xanax or alprazolam?
It's an anti-anxiety medication.
What does it do to our system when we ingest?
So it's a benzodiazepine. It has sort of the typical things we see in a lot of these, which is it sort of has a sedative effect to some degree. In higher quantities, it can decrease your respiratory drive potentially to the point of, many people do overdose on Xanax, and it's usually just from respiratory depression, so they just stop breathing.
If a person has ingested Xanax, can you give us an idea of when you would expect to see them starting to show symptoms from that ingestion?
It's very hard to say. You would kind of have to know how much they took and hopefully when they took it. If you got both of those, you might be able to say something. But I wouldn't be able to say with much certainty. I think I'd leave that to a toxicologist maybe to opine on that.
Can you safely opine that it did happen within 14 hours of death?
I would say if he had received it within 14 hours, then it's entirely possible, yes.
You'd expect him to show symptoms, correct?
Correct.
When you take into conjunction the toxicology results in this case, the internal injuries that you documented and told the jury about, and the external injuries that you have talked about in open court today, what was the ultimate ruling on cause of death in this particular case?
Sure. So the cause of death listed on the death certificate is blunt force trauma, and then contributory factors, the toxic effects of alprazolam. These have to be sort of wordsmithed a certain way to fit onto our death certificate. So stylistically, I don't like to combine them both on one line because the blunt force trauma and the alprazolam are very, very different in terms of their mechanisms. So I put the blunt force trauma in part one, and then the contributory factor being the toxic effects of alprazolam.
Is it important for you to consider those two things in conjunction with one another as well?
They must be, and especially in this case.
Can you explain that to the jury, why they must be, and especially in this case?
Well, just because there are certain things you're going to find on autopsy that have nothing to do with the cause of death. So, for instance, if someone has a massive heart attack and they happen to have marijuana in their system, you don't automatically throw the marijuana in just because it's there. But in a case like this, where you have two things that in conjunction, both or either could be contributing to the cause of death, it's best to put them together to some degree. So for instance, in this case, we have blunt force trauma and all the things we've already talked about that contribute to the cause of death, including potentially multiple impacts to the head, which could make the brain swell, and that could cause death. We've got blood loss, which could potentially cause death. We've got the pancreatic and duodenal injuries, which potentially could lead to organ failure. So lots of things there. But then at the same time, we can't ignore the fact that there's alprazolam in this child's system that can also drive down respiratory rate and cause respiratory depression, which then also could cause the brain to swell if he's not breathing properly.
When you're considering all these things in conjunction with one another, are you also considering whether or not the Xanax that you discovered in Alexavier's system was administered to Alexavier versus him ingesting it on his own?
So there's no way for me to look at a case like this and be able to say with any confidence, was this person given this medication or did they take the medication? However, what we can look at least is, was this person prescribed this medication? And we have no evidence of that.
That Alexavier was not prescribed that medication?
Not by any indication that I have so far.
Can you also look at the age and developmental level of the child in question?
Yes.
In this case, a 6-year-old child?
Correct.
Okay. And we can look at the container that the pills allegedly came from, is that correct?
Yes, you can.
Would you expect in your...
Objection. Speculation.
I didn't even ask the question.
I'm not sure which question
It was
you're
not
objecting.
it's not within the expert opinions that were disclosed.
On the issue of the pill bottle? Or what are you objecting to?
You restate that.
Judge, I actually do think it's in his report.
Well, which opinion are you saying it's in the report that?
Page 10 of 10 is in his report.
Why don't you talk to him for a second, show once you let them see what you're saying? Okay, go ahead. I'll allow you to ask the question.
Thank you. Doctor, do you have your report right in front of you?
Yes, I do.
I'm going to ask you to flip to page 10 of your report.
Okay.
Please.
I'm
Are you there? In this section of the report, do you talk about Alexavier's age and his ability, in your assessment, to open a pill bottle if it's properly sealed?
Yes, I do.
Are you talking about pill bottles that have the child safety locks on them?
Yes, I am.
Okay. And what was your assessment of that?
My assessment, I can read it off of here if you'd like. Let's see. I said, it's unclear if the child was given the medication or took it himself. However, it's unlikely that the decedent could open medicine containers if they were properly sealed.
That was a factor that you took into consideration in making your ultimate findings and conclusions?
Yes.
Dr. Quinton, in your review of this case, you had an investigative report from your office related to the underlying facts and circumstances. Is that correct?
Correct.
Okay. You have not, at least to this date, reviewed any of the law enforcement investigation in this case?
I don't recall if at some point during this last 3 years if I ever reviewed any of that, but I don't have any of those records with me at least.
Okay. And just one more time to be clear, your ruling on cause of death was what?
My ruling on cause of death was blunt force injuries, contributory factor, toxic effects of alprazolam.
And your ruling as to the manner of death for Alexavier J. Pedrin was what?
Homicide.
Thank you, Doctor.